My name's Jeff Pearl, and I am Associate Dean and Associate Chief Medical Officer at Mount Zion. Mount Zion was organized by the Jewish community and founded as a Jewish hospital in 1887. It flourished as a distinguished research hospital for nearly a century before it merged with the other distinguished medical research center in the city, UCSF. I invite you to take a few minutes to watch this video and learn about Mount Zion's role in providing the best medical care for our patients, in participating in cutting-edge medical education and research, and evolving to become a campus of one of the top medical centers in the United States.
In the 50 years following the gold rush, San Francisco grew rapidly. More than 24 hospitals sprouted all over the city. They represented different cultures, ethnic groups, and religions. Mount Zion was among them. The Jewish community began planning Mount Zion Hospital in 1887, and by 1899, the Mount Zion Hospital Association had purchased 2311 Sutter Street to remodel and use as a hospital. Mount Zion has been in the neighborhood ever since, building new buildings and remodeling old ones to meet expanding and changing program needs. There were many challenging times in the early years of Mount Zion. The earthquake and fire of 1906 left the city devastated and its hospitals swamped with the injured. World War I severely depleted the medical and nursing staff, and before the war was over, the influenza epidemic of 1918 struck with a vengeance. Over 100 influenza patients a day came to Mount Zion for care, and many nurses worked around the clock to meet the demand. Nurses played an important role at Mount Zion from its earliest years. The Mount Zion Training School for Nurses opened in 1897. It was so successful that in 1925, a separate residence for the nurses in training was opened across from the hospital. The need for the nursing school diminished by the 1950s as nursing programs at local universities expanded. The nurse training program closed after the last class graduated in June of 1964. It was also in the 1920s that Mount Zion began to evolve beyond being San Francisco's Jewish hospital. The appointment of Dr. Harold Brunn as Chief of Staff in 1929 triggered the evolution of Mount Zion from a community hospital to a renowned medical research and educational facility. Dr. Brunn brought with him the vision, energy, and new staff to invigorate and improve the patient care and research activities at Mount Zion. As a result, Mount Zion became a magnet, attracting the best and the brightest minds in research and clinical practice. Mount Zion also felt the impact of World War II. Almost half of the physicians, 62 of them, as well as many other Mount Zion staff, served in the military. After the war, San Francisco experienced a huge population increase, and the demand on Mount Zion resources exceeded its capacity. This triggered the first major expansion of the hospital since 1913, and by 1950, what is known as the A and B wings of the hospital were completed. Under the post-war administrative leadership of Mark Burke, medical services and research also expanded. By 1975, the statistics were impressive. Mount Zion was licensed for 499 beds and 36 bassinets. It had 1,800 employees and a budget of $30 million. Annually, it admitted 15,000 patients, saw 130,000 ambulatory patients, and made 5,000 home care visits. Mount Zion earned a national and an international reputation in cardiology, child development, diabetes, gastroenterology, geriatrics, home care, infectious disease, obstetrics and gynecology, and psychiatry. In 1984, Mount Zion and UCSF solidified nearly 60 years of professional cooperation by formally agreeing to joint ventures in research, education, and patient care. By 1988, the hospital leadership sought further expansion of this relationship. At the same time, the Faculty Committee on the Future of UCSF observed that the university needed an additional hospital to increase clinical capacity, and a merger was agreed upon by both institutions. Before the institutions were formally joined, another severe earthquake struck the city on October 17, 1989. At Mount Zion, the old nursing building was damaged beyond repair and had to be demolished. On July 1, 1990, the university assumed full responsibility for governance and operation of Mount Zion, and all Mount Zion employees became UCSF employees. The union with UCSF triggered many changes at Mount Zion. Some basic services were consolidated, and the core of UCSF cancer research and treatment programs were relocated to Mount Zion. Within a few years of the integration, demand for greater efficiency in many areas resulted in the merger of the UCSF Medical Center with Stanford Medical Center. This was a short-lived venture, and as it failed, selected Mount Zion services and jobs were eliminated. Although the closure of the Mount Zion emergency room and acute care services was devastating to employees and the community alike, the changes were inevitable, and plans moved forward to transform Mount Zion into the hub for UCSF cancer treatment and research and for outpatient services. The transition began immediately. The pavilion, once the Maimonides Hospital, was remodeled and is now the home of the UCSF Women's Health Center. Head and neck surgery and employee health were relocated next door to the newly renovated pharmacy building. Construction at 1701 Divisadero was completed, and it now houses a variety of UCSF services, including dermatology and the Osher Center for Integrative Medicine. The National Cancer Institute elevated the status of the UCSF Cancer Center to comprehensive, and by November 2000, the new clinical cancer building at Sutter and Divisadero was open for business. Meanwhile, the Parnassus campus needed to expand its bed capacity, and soon Mount Zion had overnight patients again. Behind the success of so many of the projects and programs at Mount Zion since its beginning are support services, volunteer services, the Auxiliary, and Mount Zion Health Fund. The Ladies' Auxiliary was formed in 1897 to help in the operation of the hospital. Today, called simply the Auxiliary, it continues to play an influential role in providing and supporting important programs and services to patients and their families. Mount Zion Health Fund also traces its origins to the founding of the hospital, and as a grant-making public charity, it continues to support educational and research endeavors at the hospital. Today, it is clear that the new leadership at the UCSF Medical Center has effectively challenged the faculty and staff at Mount Zion to realize its vision to be the best provider of healthcare services, the best place to work, and the best environment for teaching and research. Mount Zion will continue to evolve as the UCSF hub for ambulatory care, integrative medicine, and selected cancer services. Mount Zion will continue to be a productive member of UCSF far into the future.